Hi everyone, welcome to Medical Coding Made Easy. In this video, we will see about the fine needle aspiration procedures in the skin chapter or integumentary system of CPT book. And before watching the video, please don't forget to subscribe to my channel. So first, let us see what is this fine needle aspiration biopsy. In fine needle aspiration biopsy, they use a very thin needle and insert it into the skin, and they will try to collect individual cells for biopsy, because as they are using needle and the needle is very thin here, the sample which they are getting will be individual cells. Usually with a fine needle aspiration biopsy, we can get like small fluid like things easily from the body. So with the help of that, we can identify what is the problem at cellular level. So this fine needle aspiration biopsy can also be called as fine needle aspiration cytology, because we are going to study the cells. With the help of the cells, we are going to find out what is the problem there. There is another method of doing the biopsy with a needle, but that is called core needle biopsy. So what is a core needle biopsy? In a core needle biopsy, they use a little bigger needle, and with the help of that needle, they can take a tissue for sampling. So what is a tissue? Tissue means it is a group of cells. Like when there is a building, in a building you can see a wall. A wall is made up of multiple bricks. So you can consider that wall as a tissue. You can consider that individual bricks as cells. So that is how they do this core needle biopsy. They take tissues for sampling. So that is the difference between fine needle and core needle biopsies. Now we will see about the guidelines which are given for this fine needle aspiration biopsy in the skin chapter. So when they take a fine needle aspiration biopsy, sometimes they will be using imaging guidance. So what is this imaging guidance? In many places of the CPT book, you can find this imaging guidance. Imaging guidance is nothing but a scan or X-ray method which helps the doctor to place the needle in the correct position or place, because we are going to insert the needle into the human body. We have to make sure that the needle is reaching the proper place. For that only they will use this guidance, and that can be of 4 methods of X-ray and scans. So there are 4 imaging guidances, and for them we have separate codes. The codes for imaging guidance belongs to the radiology chapter, so they will always start with number 7. We have 4 important guidance codes. The first one is 76942. That is used for ultrasound guidance. 77002. That will be used for fluoroscopic guidance. 77012. That will be used for CT guidance. And 77021. That is used for MRI guidance. Please try to memorize these 4 codes, because in many places you will be finding these imaging guidance codes. If you memorize them, you don't have to go and check these codes in the radiology chapter every time. By this, you can save the time in your exam. So try to memorize them. First, let us check the codes for fine needle aspiration biopsy. Then we can move to the guidelines. The first set of code for fine needle aspiration biopsy is 10021 and 10004. These 2 codes are used for fine needle aspiration biopsy without imaging guidance. And for the first lesion, you can give 10021. For the second and any other additional lesions, you can give 10004. So if in case doctor is taking FNA biopsy from one lesion, we will just report 10021. But if the doctor is taking multiple biopsies at the same time from multiple lesions, you have to report the add-on code 10004 according to the number of the lesions that were biopsied. So here you will never use any imaging guidance codes, because this procedure is done without imaging guidance. And the next set of codes for FNA biopsy are 10005 and 10006. Both these codes will be used for FNA biopsy under ultrasound guidance. So if the doctor is using ultrasound guidance and taking fine needle aspiration biopsy, from one lesion you have to report 10005, and if he is taking the biopsy from multiple lesions, you have to report the add-on code 10006 also. And here, as it is already mentioned that the procedure is done under ultrasound guidance, don't ever report the ultrasound guidance code 76942 with these codes, because it is not needed. It is already included in the procedure. The third set of codes under FNA biopsy are used for FNA biopsy under fluoroscopic guidance. So if FNA biopsy is done under fluoroscopic guidance, we will be reporting 10007 for the first lesion and 10008 for the second and any other additional lesions. Now we'll move to the fourth set of codes. That is for CT guidance, 10009 and 10010. Both these codes will be used for FNA biopsy under CT guidance. So if we are using CT guidance and doing FNA biopsy, we will be reporting 10009 for the first lesion, and for any other additional lesion, we will be reporting 10010. And with these codes also, you can never report CT guidance code 77012, because already in this procedure, CT guidance is included. So you don't have to report it separately. Now the last set of codes under this FNA biopsy is 10011 and 10012. Both these codes will be used for FNA biopsy under MRI guidance. It is also same like above. Like for the first lesion, we will report 10011, and for any other additional lesion, we will use 10012 with MRI guidance. Here also, you don't have to report the MRI guidance code separately. Now let us check the guidelines for FNA biopsy procedure. Just imagine if the doctor is doing more than one biopsy at the same time under same imaging guidance on the same day. You will be using the corresponding add-on code for the procedure. But if the doctor is performing multiple biopsies on separate lesions, same session, same day, using different imaging modalities, how will you report it? Report the primary code for the first procedure, and also for the second procedure you will be reporting the primary code with modifier 59. And why do we use this modifier 59 here? Modifier 59 will be used when distinct and separate procedures are done together at the same time on the same day. So here doctor is using two different imaging modalities. Both are distinct procedures. So for the second procedure, we will give modifier 59. And if any other additional procedures are done, for that you can use add-on codes. So that is how we report for multiple FNA biopsies under different imaging guidance. And also note the point whether the lesions are on the same side or on the opposite side. We will not consider that here. We will use only modifier 59. And in addition to this, sometimes they do FNA biopsy and core needle biopsy at the same time. Sometimes it can be done on the same lesion with the same imaging guidance, or it can be done in different lesions with different imaging guidance. So based on that also some guidelines are given in our book. If it is like FNA and core needle biopsy on the same lesion with same imaging guidance, you don't have to separately report the imaging guidance code for core biopsy. But if they are doing FNA biopsy on one lesion and core biopsy on another lesion with same imaging guidance, then you have to report the imaging guidance code in addition to core needle biopsy with modifier 59. This goes the same for FNA biopsy and core needle biopsy on different lesions with different imaging modalities. There also you have to use modifier 59 for the imaging guidance that's used for core needle biopsy. So these are the guidelines regarding FNA and core needle biopsy in skin chapter. If you have any doubts in this, you can just drop in a comment, and thank you everyone.